Hey guys, this is Dr. P here with my grand dog Mulligan. He's very interested in what I have to say, as you can see. But I just got DM'd about a question about when to get an MRI after a bear surgery. And the question was about, should the MRI be done to see if the implant has resorbed? That's not really why we get the MRI. The MRI, we know the implant's going to resorb in about 8 weeks, and that's way too early to really get an MRI. But we usually get an MRI at 9 months, 12 months, and 24 months, 2 years. And the reason why is not to see if the implant has resorbed, but it's to see if the ends of the ligament have grown back together, and also to see how remodeled it is. So on a MRI, the ligament should look completely black. And usually at 9 months, that ligament has a little gray in it and it's not quite there. But if it's black, it might make me want to progress that patient a little bit faster. Same thing at a year and then at 24 months. And that's basically what was done during the studies. So we're just trying to mirror the studies. And I know Mulligan wanted to know the answer to that question, so I figured I'd put it out there. Thank you.